నమస్తే. హార్ట్ అటాక్స్ ఈజ్ అ ఎవర్ గ్రీన్ సబ్జెక్ట్. అంటే దాని గురించి మనం ఎంత తెలుసుకున్నా కూడా అది ఒక మహాసముద్రం లాగా ఉంటుంది. గుండె కానీ రక్తనాళాలకి కానీ సంబంధించిన ప్రాబ్లమ్స్. మనం కోవిడ్ తర్వాత హార్ట్ అటాక్స్ పెరగడం అనేది చూస్తూనే ఉన్నాము. అపార్ట్ ఫ్రమ్ దాట్ వింటర్లో, చలికాలంలో కూడా హార్ట్ అటాక్స్ ఎక్కువగా కనిపిస్తూ ఉంటాయి. సో ఈ వింటర్కి మరి హార్ట్ అటాక్స్కి ఏమైనా సంబంధం ఉందా? అసలు ఓవరాల్గా హార్ట్ అటాక్స్ ఎందుకు వస్తాయి, దానికి సొల్యూషన్ ఏంటి, ఎట్లా ప్రివెంట్ చేయొచ్చు? అఫ్ కోర్స్ ఎన్నోసార్లు మనం వింటూనే ఉంటాము, బట్ మరొకసారి మన డాక్టర్ గారు ఏం చెప్తున్నారో విందాము. అమోర్ హాస్పిటల్లో కార్డియాలజిస్ట్ గా వర్క్ చేస్తున్న డాక్టర్ ఇమ్రాన్ గారితో ఈ హార్ట్ అటాక్స్ గురించి ఆయన ఏం చెప్తారో తెలుసుకుందాం. సార్ నమస్కారం. సార్, if the person comes with a heart attack to you, so what is the procedure, what is the mode of treatment? At first, what will you do?
Yes. See, whenever we see a person with heart attack, we see what is the duration of heart attack, what are his vitals, what is his pulse, what is his blood pressure. If the duration is small, what we give is there are immediate medicines which are called as loading doses. We give blood thinners so that the clot breaks. Okay, and there will be two options: either to give an IV injection or to take directly for angiogram. So in facilities where cath lab is available, it is preferred that a person directly is being shifted to cath lab. So in cath lab, what we do is we do an angiogram. In angiogram, we can make out where is the block, to what extent is the block, and what is the treatment required. So when we see that there is a significant block, immediately we open the block and put a stent there. So this is the preferred treatment. In peripheral areas where there is no facility for cath lab, there are few medicines, injections can be given which break the clot. So those injections, if given at an appropriate time, they break the clot. The person recovers from the chest pain and the blood vessel flow is established. Later on, however, he'll require an angiogram and simultaneously stenting also, but that life threatening will be prevented. So that's the reason, even if the hospital is small and there are no facilities for cath lab, it will stay in hospital, get those medicines, and then come back to the hospital where facilities are there. Okay. Some people, what they do, they are staying in a remote place. Although hospital is there, they want directly angiogram and they waste their time. So maybe to reach the nearest cath lab will take some 4-5 hours, who knows. So during that time, that golden period is lost. So this should be avoided actually. So they should go to the near hospital, get those blood thinner injections. Then once they are stabilized, then they can come for angiogram.
ఇప్పుడు సీజన్ వింటర్ నడుస్తుంది సార్. జనరల్ గానే అంటే చల్లదనం ఎక్కువ ఉంటే రక్తనాళాలు కన్స్ట్రిక్ట్ అవుతాయి అంటారు. అంటే ఈజ్ దేర్ ఎనీ ఛాన్స్ ఆఫ్ గెటింగ్ మోర్ హార్ట్ అటాక్స్ ఇన్ వింటర్ సీజన్?
Yes, definitely. The heart attack also has got a seasonal variation, and definitely heart attacks are more common in winter season. So a lot of causes are there, but as you told, one reason is what happens when a person gets exposed to cold weather, the blood vessels constrict. That's called vasoconstriction. So when it constricts, your blood pressure rises, and your heart has to pump more. That it has to do more work. So what happens is, if a person already has blocks, then those blocks will increase. So definitely the risk of heart attack also increases when a person is exposed to winter season. Most of these people who will be having like stable angina, they will be having blocks, but they will be well controlled. Their symptoms also will increase during winter season. So winter season, one common reason is because of vasoconstriction. There are a few other reasons also why heart attacks are more common in winter season. Another reason is like during winter season, naturally we tend to be less active. We avoid exertion, we avoid activity. That also increases the risk of heart attacks actually. So definitely during winter we get more heart attacks compared to other seasons.
In overall heart attacks topic, the most important thing is how to recognize a person gets heart attack and what are the symptoms.
Yeah. See, the most common symptom obviously is chest pain. Yeah. So first and foremost is your risk category, like what is your age as a person, how you can identify. Suppose you are a 20% 25 years without any risk factors. Some chest pain you have, that is unlikely to be heart attack. But you are 30, 35, you have risk factors, you have diabetes, you are smoking, and then any amount of chest pain, you should be little cautious whether it is heart attack or what. So when a person develops heart attack, obviously he will have chest pain, which will be very severe. Okay, it will be very severe, and sometimes, most of the time, people confuse it for acidity. That is what we have seen.
Yeah.
So that they should not do. When you are having chest pain and you are in a susceptible risk, then always better to get evaluated for chest pain. Go to the hospital, get an ECG done. Okay. So any amount of chest pain, especially if it is associated with sweating, and it is increasing on exertion. So when a person develops heart attack, if he walks for some distance also, that pain will increase. Okay? And when he's climbing the stairs, that pain will increase. So this doesn't happen with the gastric pain or acidity pain. The acidity pain will be there, but when you walk around, most of the time it will get relieved or the person will be fine. But when it is heart attack, any amount of exertion will increase the load on the heart, that will increase the chest pain. So these are some warning that the pain is likely because of heart attack. The chest pain which is severe, which is not coming down, which is associated with sweating, which is increasing on exertion. So these are highly characteristic that pain can be heart origin.
Can we say that these are the red flags which will alert you from heart attack?
Yes, definitely. So whenever you experience such kind of pain, think the possibility that you are having a heart attack. See, just go to the hospital, get an ECG done. If it is gastric pain, well and good. But if it is heart attack, the earlier you go to the hospital, the more the chances of your survival and better the quality of life, even if you survive.
And before going to the hospital, ante meanwhile, any kind of first aid is necessary for this.
Yeah, no, we give some medicines actually, but until it is proven that heart attack, better not to take those medicines. So, as a patient, if you are experiencing chest pain, what you can do is don't try to waste the time. Okay, don't just go and waste time at home thinking that it is acidity, wait for 2 hours, 3 hours. Just go to the nearest possible hospital as early as possible. And as I always say, try to avoid exertion when you have chest pain.
Okay.
Don't walk, don't run to the hospital. Maybe take a vehicle. Even when you reach the hospital, go in a wheelchair. So any amount of load on the heart should be avoided during that time. Even going to washroom should be avoided. So these are the precautions which, as a person experiencing heart attack, can do. Movements like obviously some amount of movements will, any movement which increases the load on the heart should be avoided. So when you experience chest pain, just avoid exertion. Go in a like cab or something to the hospital. Even in hospital, use a wheelchair. Avoid going to washroom until it is confirmed that it is not a heart attack.
Yes.
So this is what as a patient you can do. And there are some medicines which has to be given, but until it is heart attack is confirmed, better not to take those medicines.
సార్ యాక్చువల్లీ మనము మూవీస్ లో చూస్తూ ఉంటాం. సో సంబడి విల్ ఫాల్ డౌన్ అంటే ఏదో కార్డియాక్ అరెస్ట్ అయినట్టు అన్కాన్షియస్ అయిపోతారు. సో సంబడి విల్ కమ్ అండ్ సిపిఆర్ డూయింగ్ సిపిఆర్ కావచ్చు, లేదా డైరెక్ట్ బ్రీదింగ్ ఇవ్వడం కావచ్చు. సో ఇలాంటి టెక్నిక్స్ అన్ని చేయగానే వాళ్ళు ఇమీడియట్ గా బాగైపోయారు అన్నట్టుగా చూపిస్తూ ఉంటారు. సో ఇస్ దట్ ఓకే అంటే కరెక్ట్ మెథడేనా? ఈ సిపిఆర్ ఎప్పుడు అవసరం అవుతుంది అండ్ హౌ టు గివ్ దిస్? లేదంటే ఊరికి అలా ఇవ్వడం వల్ల ఏమైనా టైం వేస్ట్ అవుతుందా? అది కొంచెం ఎక్స్ప్లెయిన్ చేయండి.
Yeah. So CPR basically is given for people who had a cardiac arrest. So first you should, like any person falling on the street will not always be a cardiac arrest.
Yeah, that's true.
So many times what happens is people will develop giddiness and they just fall down. So that is unlikely to be cardiac. In that case, if you give CPR without any reason, person will develop fracture and complications. So you have to be very careful. So what you need to do before CPR is you check the pulse of the person. If it is not there and he is not breathing, he is not responding, only in that case you have to do CPR. Okay. The basic purpose of CPR is it acts like a mechanical pump to the heart. So your heart, you are doing a mechanical pump so that blood circulation is maintained throughout the entire body until a definitive therapy has been started.
Yes.
So if you are seeing a person who has fallen down on the road and there is no pulse, no blood pressure, or he's not responding, he's not breathing, then definitely you have to start CPR, giving a chest compression. CPR includes components like ABC, we said, like when you're giving, that is airway, breathing and circulation. When you are resuscitating a person, so maintaining an airway, that is, they give mouth to mouth breathing if possible on the roadside. You maintain compression, chest compression. In a minute about you give 100 compressions, it has to be adequate. So these are measures until a person reaches the hospital or some paramedic arrives and more definitive therapy is started. So definitely a CPR will increase the chances of survival, depending on what's the cause. Suppose a person develops a brain stroke and he has collapsed and you do CPR, is all, that is unlikely to improve. If a person has a heart attack, then the possibility of person improving will be there with a CPR.
So if you want to give CPR, at first checking the pulse is more important.
Yeah. Pulse, and you have to check the breathing and whether the person is responding. Only these things are absent, then you proceed with immediate CPR. Simultaneously, some other person should be calling the ambulance or hospital.
Yeah.
So ideally, how it should be, as CPR has to be given until the person reaches the hospital or some paramedic arrives and they take over. So
Okay.
that will decrease the risk of brain damage in case the person revives. So how it will be, brain will not tolerate any amount of ischemia for a prolonged period of time. So with CPR, you are maintaining that brain perfusion.
Acha.
Okay, so when you like, if you have delay, the person has already arrested, 5-10 minutes are gone, and you started CPR, the person is unlikely to improve. Even if he improves other organs, the brain is going to get damaged.
Okay. So immediately has
Yeah,
to be given.
immediately if you start CPR, brain perfusion is maintained, and with definitive therapy, whatever the cause which caused the CPR has been corrected, the probability of survival will improve.
ఇప్పుడు దీనికి మామూలుగా లైక్ స్ట్రోక్ ఈవెన్ ఫర్ హార్ట్ అటాక్ ఆల్సో ఈజ్ దేర్ ఎనీ గోల్డెన్ టైమ్ టు రీచ్ ద హాస్పిటల్?
Yes, definitely. See, time is muscle when it comes to heart. So what it means is, you as early as you reach the hospital, the more the muscle you will save, heart muscle. So whenever there is a heart attack, the blood circulation to that part of the heart is completely blocked. So earlier you reach the hospital, maybe within 3 hours. Ideally, it has to be less than 1 hour. This is called as golden period. If you reach the hospital within 1 hour and definitive therapy has been received, then your life will be as good as normal.
Yes.
Your heart muscle also is prevented from getting damaged. And if it is a delay, like you have crossed 6 hours, 7 hours, the heart gets damaged. After that, if you open the vessel, even if you put a stent, the recovery will not be as good as that a person compared to a person who has reached within 1 hour.
Yes, that's true.
So the muscle damage will become like a scar. So definitely, the earlier you reach hospital, better will be the results.
యూ నో వెరీ వెల్ దట్ ఆఫ్టర్ కోవిడ్ హార్ట్ అటాక్స్ అనేవి చాలా చూస్తూ ఉన్నాము. ఈవెన్ మామూలుగా ఎప్పుడు ఇంతకు ముందు కన్నా కూడా ఇప్పుడు అంటే డే బై డే ఇంకా పెరుగుతూనే ఉన్నాయి. అంటే ఈజ్ దర్ ఎనీ రీజన్ ఫర్ దట్? అంటే మోర్ అంటే బ్లడ్ వెజల్స్ ఇంకా కన్స్ట్రిక్ట్ అవ్వడం కానీ అట్లాంటివి ఏమైనా ప్రాబ్లమ్స్ రేజ్ అయినాయా ఆఫ్టర్ కోవిడ్?
No, it is not entirely linked to COVID actually. See, heart attacks are quite common in young people at this particular period of time. Heart attack as such is multifactorial. It is
Yes.
not a single factor which will affect the heart. So multifactorial ante you will have risk factors for heart attack. Those risk factors include smoking, alcohol, lifestyle, and your lack of exercise, sedentary lifestyle, stress. In today's world, stress is very important.
Yes.
So all these factors, they contribute to your increasing risk of heart attack. You see, a lot of people are under a lot of stress, you can say, and stress. Apart from that, they have diseases which are not diagnosed, maybe diabetes, hypertension, or they may be like excessively consuming tobacco or some other risk factor. So all these collectively contribute to the risk of heart attack. COVID as such, there is a possibility of causing blood clots with COVID, but that is during the infective period. As a person gets infected with COVID, there is some probability that there can be blood clots. But COVID being so many years ago and linking every heart attack to COVID is not right actually.
But sometimes we see that the persons who are not at all habituated with all these kind of bad habits, but still they are getting heart attacks. Why? Even in the young age also.
Yeah. See, if you see the risk factors for heart attack, they are modifiable risk factors and non-modifiable risk factors.
Yes.
All these which I have told are modifiable risk factors. Maybe your diet, lifestyle, smoking, alcohol, everything is modifiable. A person can modify. There are some non-modifiable risk factors which cannot be modified. These include male sex. The person being born as male itself is a risk factor that he can have heart disease. So such people usually will be having some form of genetic cause. Either they will be having a family history of heart disease. That's the reason they are more prone for heart disease. Or they will be having some undiagnosed conditions. Like they will be having excessive amounts of triglycerides. Their lipids will be very high. All these, some other genetic causes also are there. So these people are prone for heart attacks. But most of the time what we see, a person suddenly dies. There can be some genetic abnormalities which are called as channelopathies. Some other inherited heart disorders also are there, where the person is prone for something called as arrhythmias. Arrhythmias is a sudden increase in the heart rate, and which, if not corrected, a person can end up in cardiac arrest. So most of these persons, young people who get heart attack, like who are dying because of sudden exertion, they likely will be having some underlying heart disease which will not be diagnosed.
ఒక 4-5 years గా కంటిన్యూస్లీ 4-5 years గా మనం ఎక్కువగా హార్ట్ అటాక్ డెత్స్ చూస్తున్నాం, ఎస్పెషల్లీ సడన్ కార్డియాక్ అరెస్ట్ అవ్వడము అట్లాంటివి ఎక్కువ కనిపిస్తాయి. అంటే ఇంతకు ముందుతో కంపేర్ చేస్తే, అంటే ఒక 4-5 years బ్యాక్ తో కంపేర్ చేస్తే వై దే ఆర్ ఇంక్రీజింగ్, అంటే హ్యాబిట్స్ అనేవి అప్పుడు ఉన్నాయి ఇప్పుడు ఉన్నాయి కదా. సో అంటే దీనికి ఒకటి రీజన్ కాదా, అంటే వాట్ మైట్ బి ద రీజన్ ఫర్ దిస్?
See, one thing is excessive use of social media, we can say. See, earlier also people used to get heart attack, but people is not come to know because there is no contact in between the people. Okay. Now people are like everyone is in contact with others. So any news person dying in some US also you will come to know. So earlier there was no method of knowing these things. So possibility is there. Earlier also heart disease was there, but definitely the risk of heart attacks has increased in the present time. All this because is again because of excessive amount of stress. Workload has increased. There's a lot of pollution everywhere. Maybe noise pollution, air pollution, water pollution. So the risk factor also has increased.
So pollution also causes heart attacks?
Yes, definitely.
Even air pollution. Air pollution is one of the risk factors for heart attack. Water pollution. All these things will increase your risk of heart attacks.
If you see in women also, I mean, okay, after menopause, women are same risk with men అని చెప్తారు కదా. బట్ బిఫోర్ మెనోపాజ్ ఆల్సో విమెన్ లో కూడా మనం చూస్తున్నాము. ఎందుకు సేమ్ అంటే వాళ్ళలో కూడా ఈ హ్యాబిట్స్ లేని వాళ్ళలో ఈస్ దట్ బికాస్ ఆఫ్ స్ట్రెస్ ఆర్ సంథింగ్ ఎల్స్?
See, women definitely until the age of menopause, their risk is quite low of heart attack. But sometimes they get heart attack, but it's very rare compared to males. Okay, it is not as common, but the people who are experiencing heart attack in such, usually they also will have some amount of risk factor. Okay, undiagnosed blood clotting disorders will be there in some of these patients, whereas where there is excessive amount of blood clot formation somewhere in the body, so they are prone for heart attacks. Some people in the pregnancy they will be taking contraceptive pills. Contraceptive pills are also a risk factor for heart attacks. They can cause blood clots. So some women rarely they also are addicted to smoking and alcohol at present times, so that also increases the risk of heart attacks. So you can say all these in women are increasing the risk of heart attacks in even in women at this present time.
ఓకే, జనరల్ గా చెప్తుంటారు కదా, స్ట్రెస్ కాజెస్
Yes.
మేబీ ఆల్ కైండ్ ఆఫ్ డిజార్డర్స్,
Yes.
డిసీజెస్ ఎస్పెషల్లీ. హౌ ఇట్ రిలేట్ టు దిస్ హార్ట్ అటాక్? అంటే స్ట్రెస్ వల్ల హార్ట్ అటాక్స్ వచ్చే రిస్క్ పెరుగుతుందా? పెరిగితే హౌ?
See, stress, what happens is your body releases stress hormone when you're in stress. Stress hormones will cause a lot of changes inside your body. They'll increase your heart rate, they'll increase your blood pressure, your blood vessels tend to constrict and they get narrowed. So there's extra amount of load which is presented on the heart. So in people, how it will be these blocks, usually it is not a one-day process. The blockages which are formed in the heart, they are present throughout, like from the childhood itself they start developing. So gradually over a period of few decades, they start building up. So in people who are already having blockages, any amount of stress will rupture those blocks. And that is when the person lands up in heart attack. So stress because of hormonal changes, which in turn will affect the circulation in the heart, increases the blood pressure, increases the heart rate. Whenever your parameters are deranged, you are prone for heart attacks.
I mean, these stress hormones will rupture the blood, these blood vessels.
Plaques, you can say. It is
Plaques.
not the stress hormones. Stress hormones will increase your heart rate, your blood pressure.
So indirectly it
Yeah,
causes.
indirectly it causes.
ఓకే ఓకే, అచ్చా. ఇప్పుడు అగైన్ ద డౌట్ ఆర్ కన్ఫ్యూజన్ ఈజ్ దేర్ ఇన్ ద సొసైటీ దట్ అబౌట్ స్టాటిన్స్.
Yes.
అంటే కొంతమంది ఏమో స్టాటిన్స్ వేసుకోవద్దు, దే ఆర్ నాట్ నెసరీ అని చెప్తారు, బట్ మోస్ట్ ఆఫ్ ది కార్డియాలజిస్ట్ యూ సజెస్ట్ దట్ స్టాటిన్స్ ఆర్ నెసరీ.
Yes.
సో ఏది నమ్మాలి, ఏది నమ్మద్దు, ఏది ఎంతవరకు కరెక్ట్?
Yeah. No, there are some risk categories where statins are indicated. Like a person with diabetes, they are prone for atherosclerosis. Atherosclerosis, and they gradually develop buildup of cholesterol plaques. Your blockages are nothing but cholesterol deposits in the heart vessels. So maybe in diabetes, or some people will be having excessive amount of bad cholesterol. So any amount of excess bad cholesterol will directly get deposited in your blood vessels, be it in the heart or in the brain. That is when your blockages will increase. So when you have indication for starting statin therapy, definitely you have to take it. What trials have proved as if you use statin, the blockages they get stabilized. So main problem is heart attack. See, even if the person has blockages, he doesn't directly land up in heart attack. It is when the blockages rupture, there is a clot formation there. It is then the person develops heart attack. So what this statin does is it reduces the cholesterol deposits in that blockages and also stabilizes that plaque so that these don't rupture. And a
Okay.
person as such will be prevented from heart attacks. So statins definitely, if you are prone for increasing lipid levels or your body has increased lipid levels and you are having risk factors like diabetes or you have blockages which are mild, moderate, statins definitely will prevent the development of heart attack.
Is there any side effects with these statins?
Yeah, see, any medicine will have some side effects, but most of these medicines, most of these side effects are tolerable side effects. With statins, we get a lot of muscle pains, body pains, myalgias. If it is too much and excessive, definitely you can reduce the dose. You can talk to a doctor and reduce the dose. But they are very rare because they're not as common as people think they are.
Okay. And one more doubt always I have. జనరల్గా విమెన్ విల్ హ్యావ్ అంటే చిన్న రక్తనాళాలు ఉంటాయి వెన్ కంపేర్ ఐ మీన్ బ్లడ్ వెజల్స్ సైజ్ ఆఫ్ ది బ్లడ్ వెజల్ ఈస్ లెస్ వెన్ కంపేర్ టు మెన్ ఇన్ విమెన్ ఐ థింక్ అంటే అలాంటప్పుడు విమెన్లో రిస్క్ ఎక్కువ ఉండాలి కదా అంటే హౌ ఇట్ ఈస్
No, there's nothing like women have small blood vessels, nothing like that. Both will have the same amount of blood vessels. So that is not related to.
వన్ స్టడీ ఆర్ సంథింగ్ ఎల్స్ ఎక్కడో నెట్లో చదివాను సార్ అంటే అందుకని మెనోపాజ్ తర్వాత విమెన్ అండ్ మెన్ ఇంకేమైనా అంటే విమెన్ కే రిస్క్ ఎక్కువ ఉంటుంది
Protective effect of estrogen, because
yeah, that's
estrogen until menopause women are relatively protected from heart disease. So once menopause is there, estrogen reduces and then the risk becomes almost equal compared to males. So it is not related to the size of blood vessels, even though blood vessels are small. Some blood vessels are small in females like the radial and other things, but that doesn't increase the chance of heart attack.
ఓకే అండ్ వన్ మోర్ డౌట్ ఈస్ దేర్ ఎనీ ఛాన్స్ దట్ డివిటీ పేషెంట్స్ అంటే వేరే అదర్ బ్లడ్ వెజల్ ప్రాబ్లం ఉన్న వాళ్ళు వాళ్ళకి హార్ట్ అటాక్స్ వచ్చే రిస్క్ ఎక్కువ ఉంటుందా
DVT is like a blood clot in the veins. Heart attack is the blood clot in the arteries.
Yes.
So some people with the DVT, depending on the cause, like what might be the cause, there are some blood coagulation disorders. These people are prone for blood clots anywhere in the body.
Okay.
So it can be in the artery, it can be in the vein. Suppose DVT is caused by such blood disorders, then definitely they are at risk for clots in the heart also.
The blood vessels.
ఈవెన్ ఫర్ వేరికోస్ వీన్స్ ఉంటే
No, varicose veins is a different condition.
Different, yeah.
Different condition. So in that case, the chances of getting a clot in the heart is not related to varicose veins.
Okay.
DVT also, if only depending on the cause. Many people we have seen like after surgery they develop DVT because of not walking, because of prolonged bed rest. These people are less prone for heart attack because their cause is something different.
Yes.
Their cause is inactivity which has caused the clot in the blood veins. So only if the cause is some blood disorder which is causing a clot in the veins, those people can get clots even in the arteries.
ప్రివెన్షన్ యాంగిల్లో ఆలోచిస్తే ఈవెన్ వింటర్ లో మీరు చెప్పారు మోర్ ఓకే బికాస్ ఆఫ్ కోల్డ్ వెదర్ దెర్ ఇస్ ఎ ఛాన్స్ టు గెట్ మోర్ హార్ట్ అటాక్స్ బట్ హౌ టు అంటే దీన్ని ప్రివెంట్ చేయాలి అంటే వాట్ ఆర్ ద ప్రికాషన్స్ వీ షుడ్ టేక్ అండ్ వాట్ ఆర్ ద ఫుడ్ వీ హ్యావ్ టు టేక్ ఎనీ కైండ్
Yeah, the prevention also is multifactorial, like just like the causes. So you have to do lifestyle changes. You have to maintain a good diet. You have to avoid smoking. You have to avoid alcohol. You have to control your risk factors. You have to control your diabetes. You have seen many times people having diabetes with excessive blood sugars, but they say they don't have symptoms, that they don't care about the sugar. But
Yes.
excessive blood sugar over a long period of time will cause increased blockages in the heart. So it is not the acute time, it is over the long period. The person has diabetes, maybe after 5-10 years he will develop very severe blockages. But if the same person, he has well controlled his sugar within the recommended range, his blockages will not be like that. It will be as good as a normal person. So that is the importance of a strict sugar control. So any person who is having risk factors like diabetes has to control his sugar. Similarly is the case with hypertension. He has to adequately control his blood pressure or cholesterol. Everything has to be well controlled. Apart from these risk factors, he has to have a healthy diet. He has to avoid saturated fats, junk food. His food should contain lot of fruits, vegetables, nuts, all healthy food. Okay, avoid fried items, avoiding sugars. So with these measures, definitely the risk of heart attack will decrease.
ఈవెన్ వింటర్ సీజన్ ఆల్సో సేమ్ కైండ్
Same measures.
Some extra precautions has to be taken during winter, that you can wear warm clothes, avoid exposure to cold, be as warm as possible.
Okay.
Okay, that will decrease the risk of angina and also decrease the risk of heart attacks.
Okay, sir. Very nice interview. One of the nice interview. Thank you, sir. Thank you so much.
Thank you.